Hello, everyone, and welcome to Mind Your Mental. Just a reminder that this podcast is not meant to be a substitute for a relationship with a licensed mental health professional. I know they are hard to find, and I get that. I have a bunch of resources on my website if you need them, but I am not your clinician. I am a psychologist, but I am not your psychologist. So if you need any specific help, please look for the help of a licensed mental health professional. Learn all you can learn from the podcast. Enjoy the episode. So I guess I'm not looking at it from the strength-based approach as like the underlying theory of therapy. I guess I see it as the way I engage with everyone is I understand the aspect of inherent strengths and then just bringing that to the forefront so you understand. It's not about like assessing and like, oh, let's see where they are. I know they're there. My goal is to, so like even when you're talking about the resources, where they start off from, now mind you, this is not, now once again, when it comes to this field, this theory, Elliot is the expert, so we're all going to learn today. But when I think about it in terms of the resource aspect of it, even just being able to identify and feel comfortable identifying what you want, I see that as strength because there's so many people who don't even feel comfortable doing that.
I think it's true. I think it's absolutely true. But I like the way I would see it is like we need to operate from a position of love and care. I think I actually refer to the work I do in this field as heart work because I think this is work we must do from our heart. And I think we try as hard as we can to intellectualize a very spiritual and connected work. And like the strength-based approaches is the intellectualization of love. And love needs to be at the center of what we do. And I mean that Christ-like love, that God-like love, that communal love. I mean that thing that makes us live and breathe. I think therapists are so bad at this that we've had to create a dynamic.
Not all of them, right? Are you talking about the one?
Not all of them.
I'm obviously saying, oh my God, shots fired. What?
Yeah, I think you are so bad. I just think as a field, we're so bad at this. We've had to intellectualize strengths and remind therapists that that client that is depressed and sobbing and struggling and relapsing, they also have strengths. Mm-hmm. Like I think the strength-based approaches are just to remind therapists not to view your client as if they're just whole bad. And I think we have to go back to the very center of warmth and care, which is just treat people like they're capable of magnificent accomplishments and change.
You know what I would say to that, though? I would say that that is not how, one, I don't think that's how the field was started, but two,
no, I agree.
I don't think that that's how, when individuals are using, depending on how they're trained, right?
Yes.
And this like westernized, individualistic aspect, I think for some people, they need to be reminded. But I will tell you, most of the colleagues that I've worked with that look like me don't see it as like the strength-based approach in terms of reminding themselves about like, or their patients about the strength. They're talking about operating from a place of strength. So even in the definition, I don't see it as, I think I see strength-based perspective differently. I talk about centering the strength within the person and acknowledging that. But I will say most colleagues that look like me don't need reminders. They operate from that realm. Now, I've always stated that I don't think you need therapy to heal, but I do think you need community. And I think it's even the aspect of the isolation that so many people will try to push on individuals. I've had a lot of patients come to me and be like, I have to upend the damage that was done by a previous clinician. Oh, you and your parent are enmeshed. You got to get rid of them. Oh, well, they don't understand you. So you probably shouldn't go to that event. Like operating from, well, community is strength. The love that you're mentioning. Like, so I feel like, I think there are certain people who more so operate like they have to be reminded. But I will say, and maybe this is just, I've just been amazed. Had the benefit of being surrounded by so many amazing clinicians that do happen to look like me. I mean, there's only like 10 of us, but like, I will also state there is, you know it. I always start off these episodes when I got a Black man, licensed mental health professional, and be like, hey y'all, we got another unicorn, because there are like more Black women in mental health than Black men, but like to be able to get one that's actually going to talk about it, that's a unicorn. And we're not out here out and about all that either. We're like narwhals, but like still have horns, but one is significantly more rare than the other, right? Like it's still a thing. You see what I'm saying? Like,
but I'm not talking to the Raquels of the world.
Mm-hmm.
Let me tell you a quick story on what I mean, and hopefully this will bring it home. I went to South Africa once to teach. And by the way, I love going to South Africa. I got a good friend there that hires me to come to South Africa. Well, pre-COVID anyway. Shout out to Jackie. But the first time I went, I was standing in front of this room, and this woman, during the very first break, I was teaching for 3 days, and during the very first break, this woman comes up to me and is in tears saying, I came to this lecture because I needed to see what we look like on this stage. Mm. And I was like, man, that's crazy. Like, and this is a country where, South Africa is a black country that did not have black power, right? And then when the lecture ended 3 days later, she came to me with a bunch of people that had come to this event with her, and they're from the Zulu nation. And she said, we're very excited because we think this is the first therapy that is going to be able to be used in our community. And I was like, really? How come? Now, in South Africa, there's a very popular university. I don't remember its full name. And they taught Jungian therapy. And the Jungians would try to go into the Zulu nation and teach these people about mental health and try to do therapy with them. And it didn't work. And they treated them like there was something wrong with them. But now here I am teaching solution-focused therapy, and they're like, this is totally resonating. I asked why not, and they said because in the Zulu language, we don't have a lot of feeling words. Our language doesn't have a lot of feeling words. So if a therapist comes into our community and asks us, how does that make you feel? We don't answer that question easily because our language doesn't really have those words. And in solution-focused brief therapy, you don't tend to ask those questions, and we think that means we're going to be able to benefit from this type of therapy. Now, how does this relate to strength-based approaches? In our field, we have a tendency to view people for what's wrong with them. Oh, you guys are not answering our how does this make you feel question, so thus that must mean there's something wrong with you, and now I have to fix that. But that's not true. There's nothing wrong with people. Every human being is both broken and beautiful. We just have to find the beauty and help them live their life from the perspective of their beauty. And I found it beautiful that they have this language without these feeling words. And once they figured that out, it's like, now we need to find a therapy that fits into that mode, and then they could benefit. And I think that's true for all people. We just need to find the groove so we can just live and be the beautiful people that we're designed to be instead of the brokenness that sometimes takes over our lives.
I love that. And especially since given cultural display rules, Black people and other people of the global majority are actually significantly less likely to verbalize and intellectualize our emotions. It's easier to ask about physical symptoms than try to get into the touchy-feelies, as it were. And I legit, y'all say, like, I know you're not trying to get touchy-feely. So what's any back problems or skin? Like, let's talk about some other stuff. I'm not going to ask you, like, how are you feeling today? And I do it just like that in session. Like, I'll be like, I totally get it. So let's talk about physical stuff. We ain't even going to talk about emotions because they're not connected. This is sorcery. I'm going to just ask you about your body. We're just going to go from there. We're just going to go off of vibes and we're going to see, just tell me about your body. Back pain, right? And there's no cure. Cool. Skin super dry. No cocoa butter working. Crazy. Hair breaking off and brittle. Man. Sleep disruption. Man. Eating is way different and you don't enjoy the activities anymore. That's crazy. These are all physical things and they're in no way connected to your mental well-being at all. And I'm just going to work with you on these things that you've identified. And we just going to go from there. Right? You cool? If I help you fix your sleep, you cool? Yeah, man. Just don't be trying to get me talk about stuff. I'm not. I'm going to just try to fix your sleep. That's it. And once I fix your sleep, you can dip. That's it. All right, cool. You don't like playing basketball no more? You want to like it again? If I get you to like basketball again, you cool? Yes. That's what's up. Let's just see. We'll see. And, I'm not trying to trick you at all. Like that's typically the route that I go. Like, and it's not even just like the aspect, it's definitely the aspect of culture. But I when I've worked with patients, especially when I was at Hopkins, people are like, oh, well, let's get to the attachment mode and let's get to that. And I'm like, this person doesn't have tokens to get to session. You trying to ask them to do like a swan dive and they're in the middle of the ocean drowning. Why aren't we handing them resources? You talk about attachment and they don't have food. Let's start with like, do we have any social programs that we can help? Because it's very hard to think about your depression when the thing making you depressed is you're hungry. I guarantee you they stop being depressed if we signed them up for that program.
That's 100% true.
It's like, have some sense, you know, like, but anyway, thank you. So I don't want to take up all your time. I feel like this was incredibly helpful. Tell the people where they can find you. First of all, I mean, basically, they can basically just find you outside because you're always working. But let's just say, let's just say the specific social media, your podcast, all of that. If they want to book you to speak, all of that. And honestly, if you want to book them, you might have to try to book for 2025 because you sound like you're already busy, but y'all can always try. Y'all can always send an email and try. Because Elliot got back to me mad quick. I said, what?
My assistant got back to me.
Oh, your assistant. See? Okay, well, you know what? Contact Elliot's assistant. So tell them where they can find you.
Look, you can find me on my website, which is elliottconnie.com. Make sure you spell my name right, 2 L's and 2 T's, elliottconnie.com. Mm-hmm. You can also find me on social media at Elliot Speaks across all platforms, Instagram, Facebook, X, Threads, at Elliot Speaks, 2 L's, 2 T's. I'd love to hear from everybody. I'd love to be in touch with everybody. I'd love to be inspired by everybody. Like, people always talk about how inspirational I am, but everybody inspires me. So being in contact with me fills me up. So thank you.
I love that. It's clear because you love what you do. And also anyone, if you're like driving and you're listening to this, all of this information is also going to be on show notes. So if you get back and you're like, I listened to the episode and I didn't want to re-listen to it, all you got to do is click the show notes and all of that information is going to be there too. If you saw a clip about this on Instagram, Elliot is tagged on that as well. So you can just click that button and we make it easy for you. I understand life is tough. Well, just click the button, y'all. If it's highlighted in blue, it's a link. click the link, y'all. I'm trying to help you out, you know? All right. So y'all have a good rest of your day. And just remember to be kind to yourself. Hey, everyone, just a reminder that Mind Your Mental is not just a podcast. It is also a amazing community, if I do say so myself. It's phenomenal. I mean, you get more access to me. What more could you want in this life? So if you want to join the community, if you're not already on the community, go to my social media. My social media is the same, Raquel Martin, PhD, and DM me the word community so you can get details on joining this amazing flipping community. You get more access to me, y'all. Like, I'm a delight. All right. Hope to see you there.